Hello guys, I am Vishnu and we are part of DRX Pharma for You YouTube channel with our common motive of sharing practical knowledge to maximum people around. Are back with another video and this is going to be a little interesting and I believe that at least few people will definitely benefit from it. This video is regarding how to remember side effect of medications. Now, commonly, we usually see a lot of people having difficulties with remembering medications. I was also a teacher and being a student also, and I still believe that I am a student. Although I am a clinical pharmacist, I had been an assistant professor. I still believe that I have a lot of things to learn, and we are all students at every stage of life. So I also used to encounter difficulties in remembering side effects of medicines. So I tried different ways to remember, and I came up with 5 strategies to remember side effect of medicines. So today we will be seeing which are the different methods to remember medicinal side effects. Because there are so many medicines in the market, so to remember their side effects is a very big challenge, and I hope this presentation will be a good guide for you to achieve the same. If you look at the scope of this presentation, there are thousands of medicines in the market, whether it be both India and abroad. Thousands of medicines have thousands of side effects as well. And if you are trying to remember all of them consistently, it's a very big challenge. But again, if you don't remember the side effects, how will you monitor patients? For example, amikacin, which is an aminoglycoside, is being used in a patient who is suffering already from CKD, chronic kidney disease. And we know that aminoglycosides usually cause nephrotoxicity. That means they damage the kidney. So unless we know that side effect, how are we going to monitor renal function tests in those patients? The nephrotoxicity will keep on worsening. For example, you know a very common medicine that is telmisartan or captopril. These are either ACE inhibitors or angiotensin receptor blockers. They are used in CKD patients. But the problem with these medicines is that they cause hyperkalemia, which can lead to nephrotoxicity. So if a CKD patient or a patient with kidney dysfunction is under telmisartan or ramipril captopril therapy, their renal function should be monitored. So unless and until we know the side effects, how will we monitor the patients? How will we counsel the patients? So a lot of things are on the danger area. So remembering the side effects is very important. Yes, I do agree to the fact that we can't remember all the side effects of all medicines because some of the side effects are either very common, which we can easily remember, and some of the side effects are very rare also, which means that it happens in specific racial population or very rare cases due to some kind of mutation or some genetic polymorphisms in our body, which is reacting too much to that medicine. Many reasons are there. So obviously we can't remember everything, but yes, to some extent we can. So this presentation throws light on my personal experience in dealing with ADR remembrance, and I hope that you will have a good time ahead to understand the same. So these are my 5 strategies to remember ADRs. The first strategy is the LIPPINCOTT method. The second strategy is the mnemonic method. The third strategy is the relationship journalist method. The fourth strategy is the table method. And the fifth strategy is the WSR method. So these are the 5 methods that I personally believe can help you in remembering side effect of medicines. So let's go into the details. First, we will go into the LIPPINCOTT method. Always remember that LIPPINCOTT is one of my favorite books regarding pharmacology. Yes, we do have difficulties in that particular subject because it is so huge and so vast, and a lot of medicines keep on getting added every year. whether it is in India, whether it is outside India. So many new medicines are coming into the market. So pharmacology, yes, it is a very difficult subject. But Lippincott is a bit different. Even in competitive exams also, if you are preparing for competitive exams also, Lippincott is a very good textbook. And if you want to study things precisely and you have to retain memory also. If you want to retain the memory also, Lippincott is a very good book. The reason is because the side effect of medicines in Lippincott are shown through pictures. And obviously, this is one thing that whenever we see something or we see a video of something or we see something happening in real life, we tend to remember it better than reading it in a particular writing or a book or something. So that is the strategy here. According to scientific evidence, we remember things better when we visualize it. So the more you see the pictures of drug ADR, the better you remember. So here we will get animated pictures of side effects, and those animated pictures will definitely have a long-lasting impression on your memory. So the best way to study ADRs visually is Lippincott's pharmacology reviews. So if you want to know details about this, please subscribe to our channel. Please be in touch with us. We are there in Instagram also. So the link to that will be shared in the description below. Please do be in touch with us so that we can share you the books. And if you want to contact us personally also, you can contact us in Instagram, and then we will share you the contact details where you can ask us details about this book. I know many of you know about this book, but just having a book doesn't make sense. We have to know how to study it properly also. So Lippincott is one of the best international books to study pharmacology easily. And in Lippincott, majority of the ADRs are given in pictures. So let's go into an example. So the picture that you see in front are the side effects of two classes of medications. On the left-hand side, you see the side effects of propranolol. And on the right-hand side, you see the side effects of muscarinic antagonists. So these are also known as anticholinergics. So if you look closely, the side effects are shown in a pictorial manner instead of simply writing in words. So I'm not trying to denounce any book or say that any book is bad, but this is a psychological experience that when you see things, you remember better. So I believe that for remembering side effects, Lippincott is good. So if you look at the side effects of propranolol, first of all, we need to understand that propranolol is a non-selective beta blocker. And always remember, we have 3 beta receptors in our body. We have beta 1, which is present in the blood vessels and helps in vasoconstriction. It is also present in the juxtaglomerular cells of the kidney, which triggers the production of renin, and as a result of which the RAS pathway, renin-angiotensin-aldosterone pathway, starts. Beta 2 receptors are present in our lungs, which is good for bronchodilation, and that is why we use beta 2 agonists in asthma and COPD. Beta 2 receptors are also useful because they help in vasodilation also. So beta 1 causes vasoconstriction, but beta 2 is very good for vasodilation. And the beta 2 receptors are present in many other areas also. And beta 3 receptors are present in adipose tissue. Their main function is to release an enzyme known as lipase, which helps in reducing bad cholesterol and increasing good cholesterol. So here the side effects have been shown. If you look at the side effects, it has been shown completely in pictures. So propranolol is a non-selective beta blocker. That means it will block beta 1 receptor also, beta 2 receptor also, and beta 3 receptors also. So that is why the side effects of propranolol will be huge. So you can easily understand what may be the side effects. So they are shown in pictures here. So that is why non-selective beta blockers should never be used in patients who are having breathing troubles, especially asthma and COPD, because they cause worsening of bronchoconstriction. And propranolol is also a very interesting molecule because it undergoes extensive first-pass metabolism. That means it is rapidly broken down. So the pharmacological activity that you get is very minimum. And that is why this is the antihypertensive of choice in patients who are suffering from liver cirrhosis. If you read the chapter liver cirrhosis, there is a condition known as portal hypertension. So in that condition, propranolol is the drug of choice because already the liver is damaged. So first pass metabolism will not happen and sufficient plasma concentration will be retained. So this is just a practical knowledge that I gave you. If you look at the right-hand side, it is written side effects of muscarinic antagonists. Muscarinic means acetylcholine, antagonist means blocker. So acetylcholine blocker means anticholinergics. Always remember, whatever secretions you produce, whether it is your sweat, whether it is your saliva, whether it is urine, whatever secretions are being produced by you, it is because of acetylcholine. So when acetylcholine is blocked, your secretions will be blocked. So if acetylcholine is blocked, you can have dry mouth. If acetylcholine is blocked, then stomach acid will also not be produced. If acetylcholine is blocked, then urine production will not happen. Urine will get stored in the bladder. That can lead to long-term urinary tract infection in the long term. And definitely fecal expulsion will not happen, so it can cause constipation. So the side effects are shown in pictures here. The next strategy is the mnemonic method. This is very common. I hope everybody knows about this. Many of you have subscribed to Instagram channels. You have seen in many textbooks. In fact, one of the presentation that I made on mnemonics is also thanks to some very good textbooks that I have in my hand. And the authors have written very, very classy mnemonics. So mnemonic is also a good strategy to remember side effects. But the problem with mnemonics is that if you get addicted to this too much, then you will start making mnemonics of literally everything. And then to remember those mnemonics, you will have to make a bigger mnemonic. So I personally suggest that mnemonics should be used in control. Don't use it literally don't use it indiscriminately. So mnemonics help in easy remembrance. But the more you name mnemonics, the more you get confused to remember the mnemonics. So please make sure that you use it only when necessary. So this is just an example to remember the side effects or contraindications of non-selective beta blockers, as I explained before. For example, propranolol. You can remember the mnemonic ABCD. So A stands for asthma. B stands for heart block because it blocks beta-1 receptor. So bradycardia is very, very common. So bradycardia can lead to heart block. CHF is congestive heart failure because heart failure is a condition in which the heart is not able to beat properly. So if bradycardia is happening because of non-selective blocker, then definitely the things can get worse. And obviously diabetes mellitus. We'll come to that in some other video. This is also very interesting why beta blockers, especially non-selective ones, should never be used in diabetes. To remember the uses of acetazolamide, acetazolamide is a carbonic anhydrase inhibitor. So you can remember the code GAME. G stands for glaucoma because it is a carbonic anhydrase inhibitor. Alkalinization of urine because it's a basic molecule. Mountain sickness also, especially people who go for trekking trips in higher elevations, they have a problem of mountain sickness for that, especially due to the low concentration of oxygen. Acetazolamide helps in that. And the fourth is a very, very interesting type of epilepsy that usually happens in females. So this is called catamenial epilepsy. This is actually not necessary that it will happen to everyone. Maybe many very rare people will report it. But this is an epilepsy that usually happens during periods. So for this, we need to understand an important aspect. Estrogen and progesterone are the hormones which are related to periods. So they usually balance the things that happens during the menstrual cycle. Estrogen provokes seizures and progesterone reduces seizures. So there is a balance, and that is why in most females, this thing is not common because usually it is under balance. But if there is a condition in which estrogen level is high and progesterone level is low, So definitely estrogen will provoke seizures, and progesterone quantity is so low that it cannot neutralize it. In that condition, catamenial epilepsy may occur. So in that condition, the drug of choice is acetazolamide. But again, as I'm telling you, catamenial epilepsy is not so common. So that is another topic. But yes, this is a mnemonic method that you can remember. The third strategy is called the journalist relationship method. So this is very interesting because this is something that you can relate in your day-to-day life. Journalist is a person who asks questions. So as we know that we have 4 pillars of democracy, in that one pillar is journalism. And the function of a journalist is to ask questions regardless of who is in power. Because it is the people who want to know the answers, and the journalist tries to bring answers to the people through the politicians or whoever it is. Relationship means it is based on understanding. Let it be any relationship in this world, unless and until understanding is there, no relation will survive. So how am I connecting these two terminologies to remembering the side effects of a medicine? So journalist is a person who asks questions. Relationship means understanding is important. So you have to ask yourself, if a particular ADR is happening, why it is happening? What is the main problem that we usually encounter is that a book is telling you that a particular molecule is causing this ADR, and we are studying it by heart. We don't try to analyze why it occurs. And when we don't try to analyze why it occurs, it is just a mug-up study. Finally, one day we will forget it. But when you try to understand the mechanism behind that ADR, you will be able to remember better. So journalist means asking questions. So you have to ask yourself why pantoprazole causes insomnia. And then you will try to find the answer. So relationship means trying to go into the depth, trying to find the reason. And then when you get the reason, relationship means understanding. So you are understanding the reason behind. So as a result of which, you will get the answer as to why pantoprazole causes insomnia. So the more you ask questions, the better you understand. Similarly, the more you try to question or understand why the ADR occurs, the better you remember. So the best way to remember an ADR is to understand why it occurs. So this is an example. Why are diuretics not safe in cirrhosis patients? So always remember, we have to understand what is the function of the liver. The liver has a function called detoxification, in which the liver, like for example, you are eating a non-vegetarian food or a diet which is rich in proteins. So protein means amino acid. So that in your body gets converted into toxic ammonia, which is harmful for your body. Liver detoxifies it, converts it into urea, which is excreted from the body. But when you are having any kind of liver disease, especially cirrhosis and all this kind of conditions, the liver does not have that function of detoxifying ammonia. So what will happen? If you are increasing your protein intake, that protein gets converted into ammonia. This ammonia crosses the blood-brain barrier, enters into the CNS, and causes life-threatening hepatic encephalopathy. This you may have studied in alcoholic liver disease or liver cirrhosis. Now, the problem of diuretics is that they have a sulfonamide structure. Amide means NH2CONH2, means it is exactly it is means it is consisting of a amino group. Amino group means ammonia. So nitrogen can lead to ammonia. So diuretics, if it is used in a patient who is having severe liver damage, it can increase further the level of ammonia, which can cause hepatic encephalopathy. And that is why diuretics are contraindicated in severe liver disease or patients suffering from liver cirrhosis. Why can proton pump inhibitors cause constipation? Always remember, magnesium has very interesting things in our body. If magnesium level is very high in your body, it can cause diarrhea. So if you are suffering from cholera, if you are suffering from any kind of diarrheal condition, please stay away from magnesium supplements if you are taking them. because magnesium in high level can cause diarrhea. And pantoprazole or any proton pump inhibitor, they cause hypomagnesemia as a side effect. So definitely they reduce magnesium levels. And when magnesium level reduces, it causes constipation. So simply don't read from a textbook or from a website or from an app that PPIs cause constipation. Please try to understand the reason behind it, which will help you to analyze a particular disease or a particular pharmacological action or a side effect better. Now, this is more interesting. Sometime before I said that PPIs can cause constipation. Now we are saying that PPIs can cause diarrhea. So we are in a very complex situation where PPIs can cause constipation also, and it can cause diarrhea also. So when you are reading some side effects of medicines, you may also get confused that how can a molecule cause constipation and diarrhea? For example, there is a medicine called amiodarone, which is used in arrhythmias. Amiodarone can cause hypothyroidism also, and it can cause hyperthyroidism also. So, and there is another medicine called dopamine, especially dopamine injection. So, dopamine injection, we usually give in high dose in severe shock condition. There it causes hypertension. But levodopa, which is a dopamine analog, or it is a medicine which is used in Parkinson, in normal doses, it causes hypotension. So like that, lot of complexities are there. We will decode them later. So here we are looking into why can PPI cause diarrhea. So PPIs usually block proton pump. So proton pump is blocked means acid production will not happen. And always remember, no matter how much well you are cooking food, whenever you are eating food, some amount of organisms are also going with it. But it doesn't mean that you are going to face problems, because the gastric acid, the hydrochloric acid in your stomach neutralizes it. But when you are taking PPI for a very long time, low level of gastric acid, so pathogenic organisms can colonize in the gut that can cause diarrhea. For example, Clostridium difficile, Salmonella species, Campylobacter species, they can colonize. And that there is another reason for diarrhea also. If gastric acid level is low, protein is not digested properly. So if this kind of people eat too much of junk food or any kind of food which is extremely rich in proteins, it is a matter of concern, because protein will not get digested properly. That can also lead to diarrhea. So this is called the journalist relationship method. Why can haloperidol cause sexual dysfunction? Always remember the emotions, feelings, the sexual drive that you have, the gambling tendency, the excitement that you have is because of dopamine. And haloperidol is a very high potency anti-dopaminergic agent which is used in schizophrenia. So when haloperidol blocks dopamine receptors, dopamine level is reduced. So as a result, it can cause erectile dysfunction, it can cause reduced libido and amenorrhea in patients. The next strategy is the table method. So this is applicable for reading a tabular column of side effects. Making a tabular column and studying helps in easy remembrance, and you can make it in the form of a colorful chart. For example, in many textbooks, you will see, especially in textbooks like Katzung and all, you will see that in between they summarize the side effects, the doses, the uses, and important points of medicines in a form of a table. So if you are making it in the form of a table, the entire chapter, whatever medicines are being used, if you are summarizing in the form of a table, and if you are studying that table, writing and studying that table, it will be good. Because a tabular column always makes you feel psychologically good that the entire chapter is summarized in a single table, and you can have that encouragement to remember it easily. So this is actually a screenshot from the LIPPINCOTT textbook. So these are actually anti-metabolite agents. These are anti-cancer agents. So almost all of the anti-cancer agents have been summarized in this table. The route of administration, the adverse effects, the significant drug interactions, what are the monitoring parameters, and some important catch points. They have been summarized. Although for every anti-cancer, you will get so many details in various textbooks, here they have summarized in a short table. So if you don't want to read the details too much, you can remember or make your own table and study. And the last strategy is the WSR method. This is something that I always advise people, and it is called write, study, and revise. I repeat, write, study, and revise. I have always seen a lot of people, when they study side effects or when they study anything, they have a tendency to mark it in their textbook. They have a tendency to not make notes of their own. And even if people make notes of their own, they don't know how to make notes. They directly copy the sentence, comma, full stop, everything of what is being written in another book. So that is not making notes. Making your own notes means you are presenting in your own words what you understood from something that you read. So this is a very important psychology, and this is a fact that is supported by many neurologists, that the more you write and study, the better your memory will be, the better your handwriting will be. Many people have disastrous handwriting when they write answers, especially if they are writing in a hurry. Their handwriting becomes disastrous because they don't have a tendency to write and study. They don't have that practice. The more you write and study, your memory becomes sharp. And when you have a tendency of writing and studying, that is also reflecting in your presentations. So you can make very good presentations also, because you are summarizing your own words, and then you will be a champion in what you do. Your knowledge and practical skills will also increase, because that is also because you are writing in your own words. So definitely you will start thinking better, and you will have a good initiative behavior also. And definitely your confidence will also increase, because it is your own notes. You have your authorization on that, and you can feel happy that you understood something and wrote in your own notes. So please make sure that you write, study, and keep revising each day for better results. So this is my personal advice to people, that please make sure that you write, study, and keep revising. For example, today you studied that proton pump inhibitors cause diarrhea. You studied the mechanism behind it. Tomorrow, when you are studying something new, try to revise what you studied today. If you forgot, again study it. Like this, if you make a pattern, after almost 3 weeks or something, it will become a habit, and then it will automatically come inside you, and you will start remembering lot of things, not just side effects, lot of interesting things about medicines that we commonly miss. So this is my presentation on how to remember ADRs. If you have your own ideas, please feel free to share the same. These are the ideas that I experimented, and I am feeling very happy and proud to share that I am quite successful in what I did till now. And I believe that you too will be successful. We have an Instagram page where you can follow us. The link will be shared below. There also you can contact us if you require notes, if you require guidance. I am free on Sundays. You can contact me on those days. And please remember, this channel is not just for pharmacy. This is for anybody who is interested in the medical profession or who are already in the medical profession. Because I believe that medicine is not something that is restricted to a particular course or a particular department. It is a very global thing where any person from the medical profession or any healthcare practitioner or any healthcare professional can be a part of. So if you believe that this information has made some of an impact to you, then please do share and subscribe our channel. We will keep uploading videos every day or every alternative day. Lot of interesting facts that you may have seen in the textbooks, but you missed out, or maybe you may not have even heard of. All those things we will be sharing here. Because as our motto says, books are available everywhere, notes are available everywhere, but practical knowledge is not available everywhere. And we are here to share the best practical knowledge in the easiest way possible. So thank you for viewing this. And as a part of DRX Pharma for You channel, this is me, Vishnu, signing off for today. Definitely we'll be back with another intriguing video, another interesting video in the future days to come. Thank you and goodbye.